Madam Majority Leader, are we doing Senate Joint Resolution 33? Okay. Mr. Kohler, please read the title of Senate Joint Resolution 33.
Senate Joint Resolution 33 by Senators Martinez, Humanic, and Gonzalez, also Representatives Brown and Janal, concerning the designation of August 2016 as Spinal Muscular Atrophy Awareness Month in Colorado.
Representative Janal.
Mr. Speaker Pro Tem, I move SJR 33 and ask for it to be read at length.
Whereas spinal muscular atrophy, SMA, is the leading genetic killer of children under the age of 2, and 1 in 50 Americans carries the gene that causes SMA. And whereas SMA is known to cause degeneration in voluntary muscle movement for those who survive the disease. And whereas SMA crosses all racial and ethnic boundaries, affecting people of all ages and genders. And whereas increased awareness about SMA will lead to increased public knowledge and support for both disease research and the families affected by this disease, hopefully leading to a cure. And whereas patient groups have named the month of August as National Spinal Muscular Atrophy Awareness Month in order to raise awareness and promote research of this devastating disease. And whereas organizations working to find an effective treatment and cure for SMA and the families dealing with this disease deserve our support. Now therefore be it resolved by the Senate of the 70th General Assembly of the State of Colorado, the House of Representatives concurring herein, that we, the General Assembly, hereby designate the month of August 2016 as Spinal Muscular Atrophy Awareness Month in Colorado.
Representative Janal.
Thank you, Mr. Speaker Pro Tem. I rise in support of SJR 33. Spinal muscular atrophy, or SMA, as we are calling it, is a muscular disease that's passed on genetically to children and by their parents. It's a recessive genetic disease, meaning that both parents must carry a copy of the recessive SMA gene. Spinal muscular atrophy is an inherited condition that causes nerve cells in the lower part of the brain and spinal cord to break down and die. And when this happens, the brain stops sending signals to the body's muscles. When the muscles don't get direction on how to move, they become inactive, they get smaller, and they begin to waste away, a condition that is known as atrophy. This includes the arms, the legs, the neck, the back, and basically all the muscles in your body. Babies with SMA can have difficulty crawling, walking, even breathing, and older children can have trouble getting around and mastering simple tasks of everyday life, like just combing their hair or skipping or having fun. 1 out of every 40 people is a carrier of this recessive gene. The brain's not affected, however, only the muscles, and the patients that have been tested have at least an average, if not an above average, intelligence. So please don't make the mistake of treating them as intellectually disabled. Their bodies may not be perfect, but their minds are sharp. SMA affects a child's muscular development, and the severity depends on the type. There are several types. It ranges from 0 to 4. 0 and type 1 are the most severe, affecting children while they're still in the womb or shortly after birth. And type 4 is the least severe, which is affecting adults. Genetic testing on a blood sample or a tissue sample is done to identify whether the genetic mutation is present. But interestingly and currently, there is no cure or treatment for SMA, and the lifespan with SMA, especially for a child, is about 2 years or less, maybe longer, depending, but the average is about 2 years. SMA is the #1 genetic killer of young children, and it occurs in nearly 1 in 6,000 births. 1 in 40 people, or nearly 10 million Americans, unknowingly carry this gene that's responsible for spinal muscular atrophy. SMA does not discriminate based on race, ethnicity, or gender, and there, again, is no treatment, no cure, but there is hope because the National Institute of Health and other various organizations and geneticists are working diligently to find a cure for spinal muscular atrophy. So I ask for your support on this joint resolution.
Representative Brown.
Thank you, Mr. Speaker Pro Tem, and thank you for allowing me to be on this resolution with you. SMA is a terrible disease. I'm not going to say a whole lot. about it. But designating the month of August as Spinal Muscular Atrophy Awareness Month in Colorado will bring some light to this disease. And, you know, we live in a wonderful time when, you know, I believe that God has given us the knowledge to tackle diseases like this. And so I would ask for your yes vote on SGR 33.
Is there further discussion on Senate Joint Resolution 33? Seeing none and seeing no objection to a voice vote, the question before us is the passage of Senate Joint Resolution 33. All those in favor say aye.
Aye.
Those opposed say no. Senate Joint Resolution 33 is passed. Representative Janal.
Mr. Speaker Pro Tem, I ask that the current roll call be added to co-sponsors, as co-sponsors.
Seeing no objection, the current roll call will be added as co-sponsors to Senate Joint Resolution 33. Thank you, members.